I'm Dr. Scott Brown, board-certified chiropractic neurologist. And today I'm going to be talking about something that concerns more of you than you realize, which is vertigo, dizziness, and disequilibrium or balance disorders. Something that almost none of you probably know are these statistics. Falls are the #1 cause of death over 65, the #2 cause of death over age 55, the #4 cause of death among 15 to 34-year-olds in the prime of their life, basically, and the #1 cause of death of infants, 1 year old. So what's going on? Well, there are three components, basically, to balance. You have something called proprioception. Now, proprioception means you feel from your joint muscle spindles and mechanoreceptors the information that gravity transmits from the earth to your brain, telling you where you are. This can cause problems with disequilibrium. You have your eyes, which can see where you are, see where you step, where you put your hand. And these have an effect on your balance and equilibrium. And then there's an important part called the vestibular system in your brain, which consists of a central vestibular system, which is all inside the brain itself, and a peripheral vestibular system, which involves your inner ear mechanisms. And what you hear of, most of you, when you hear about balance disorders, is inner ear mechanisms. It involves 3 semicircular canals and 2 otoliths in the inner ear mechanism. And the semicircular canals are responsible for what's called angular acceleration. So if I am moving in an angle like this, that involves one of the 3 semicircular canals, an anterior, a horizontal, and a posterior canal. And if I'm translating myself forward or backward or up and down, that's a linear component, and that involves the otoliths called the utricle and the saccule. The reason I'm going into this detail on this is because most people who have balance or inner ear, dizziness or vertigo, they're just automatically assumed to have an infection or an inner ear problem. And that's only one of the types of problems that can cause these types of vertiginous issues. Now, these peripheral systems do control your eyes and your muscle movements, and they very often are involved, but it's not everything, because there are central mechanisms as well. So let's look at some other parts of the cerebellum that could also cause problems. Now, oxygen we all depend on, but the most oxygen-dependent part of our brains is the cerebellum, which is in the back of the brain here. And this cerebellum is responsible not only for balance and coordination, but in very recent research we now know that it has to function in order for our thinking, our intelligent brain to work. So if this part of the brain doesn't develop, then our thinking brain will never become functional as well as it could. So those of you who are having vertigo and dizziness problems, you may also be having cerebellar problems, or children that have developmental problems may also be having cerebellar problems. The very midline, the very center part of the cerebellum, called the flocculus, is involved with balance. And then there's other areas that are more lateral, called the vermis, that's more involved with the actual coordinating events. Then there's an even more lateral area, the spinocerebellum, which is involved with your posture and how you hold yourself. And then finally we were talking about the neocerebellum, which is the one that actually coordinates our thinking. Problems with any of these areas can lead to vertiginous types of symptoms, dizziness, lightheadedness, nausea, and any number of conditions can be involved. Meniere's disease, motion sickness, vestibular migraines, inner ear trauma, perilymphatic fistula, ototoxicity, which is toxicity from medications basically, acoustic neuromas, which are benign tumors, BPPV, benign paroxysmal positional vertigo, vertebral basilar insufficiency, labyrinthitis, MS, which is multiple sclerosis, and in general aging can all cause these problems. Now, some of the things that you can see with people who have their head tilted in one direction, or they tend to sway in one direction, they tend to trip on one foot, they have muscle weakness on one side of the body, they have a sense of spin. Now, some people have a spin which is called egocentric, where they are at the center and the world is spinning around them. and other people have a spin where they're spinning around the world, so to speak, and that's called exocentric. These types of spins tell us something about what direction to go in when we evaluate these conditions. Now, at NASA in the 60s, they were having trouble with astronauts developing vertigo in space. And so sophisticated technology was developed to identify these problems which could not be identified on the normal neurological testing that we do to test people's cerebellums. So that technology is now available to us to not only determine what type of vestibular problem you have, whether central or physical or vestibular, excuse me, central or peripheral, but also can tell us whether or not you're at risk for a fall. So I want you to know that these problems are something that most people have at some time in their life. As I told you, it's the #1 cause of death of a lot of people that are out there watching this video right now. So let me just show you a few simple things that you can do at home that might assist you in knowing if you have a vestibular problem. #1, if you're already tripping or falling, or you feel like the world is spinning, or you get lightheaded or dizzy, you probably need to have a workup. I mean, you're already having symptoms. But what about those people who are just wondering? Maybe you had a fall recently, or you're not sure. Well, here are a few tests you can do at home that might be fun, but you need some assistance. So make sure you have someone with you. And if you stand with your feet together, and you simply close your eyes, and you start to move or fall in one direction, even if you don't fall, if you feel yourself swaying in one direction, you may have a vestibular problem or a cerebellar problem on that side of the brain. On the other hand, if you stand with your eyes closed and you try to touch your nose with your left pinky finger and you hit your eyebrow or somewhere up here, and on the other one you hit right on the nose, the chances are the one you missed with represents that you have a problem in the cerebellum on that side. If you take your hands like this and you slap the back and the front as fast as you can with one hand, and you can really hear that slap on both sides, and on the other hand it's uncoordinated and you can hardly hear any kind of real coordination there, and you can actually feel the difference in coordination. If it's significant, you probably have a cerebellar problem. And finally, if you put your hands in front of you with your eyes closed and you lift your legs as high as you can and march in place like a soldier for 30 seconds and have someone time it. And if at the end of 30 seconds you open your eyes and all of a sudden you're turned to the left, the chances are you have a problem on that side of the cerebellum. So these are little tests that you can do at home. Of course, they don't prove anything, and in and of themselves, they can't tell you anything. But if you're having problems in any of these tests, the chances are there are cerebellar problems going on in you right now. With brain-based therapeutics, we have the technology and the skills to correct these problems. Not just the academic knowledge, but the actual proven corrective therapeutics. We have a waiting list practice, and so I like to screen people before they come in with a 5-minute phone conversation. If you're having these types of problems, get in touch with my staff and set up a 5-minute phone consultation so that you and I can talk about your particular issues. I appreciate your time. Thank you.